So let's talk about coronary artery disease. So coronary artery disease is the most common type of heart disease that we have. It happens when one or more of our coronary arteries, which are arteries that wrap around the heart. So looking at this picture over here, you see the red lines that are wrapped around the heart. Those are your coronary arteries. They supply blood flow to your heart because your heart needs to then pump out blood to the rest of your body. So when you hear people talking about coronary arteries, that just means the arteries that are wrapped around the heart that supply blood to the heart. If the heart doesn't get blood flow, the rest of the body can't get blood flow because the heart pumps blood to the rest of the body. So coronary artery disease happens when one or more of these arteries becomes narrow or blocked by plaque, which is a sticky fatty substance that builds up over years. So above, you can see I have a healthy artery. You can see it looks like a hose, and it looks like blood flow can happen through it quickly. That's the top image. Below, you can see, sorry about the sign. Below, you can see here an unhealthy artery that has plaque, which is that fatty cholesterol-y substance that blocks blood flow from going through normally. So remember, these arteries wrap around the heart, and you want them to be as clear and strong as possible to get blood flow to your heart so that that blood flow can then get to the rest of the body. So usually blood flows through these arteries like water flows through a hose, but in coronary artery disease, these tiny arteries become damaged. So this damage causes the vessels to become narrow, stiff, or blocked. For example, this picture right here. When these tiny arteries around the heart get hard or stiff, we call that atherosclerosis. And so that's when we're starting to say that, okay, we're starting to notice some heart disease happening there. So continuing, so coronary artery disease can cause things like chest pain, that's also called angina, heart attacks, which is when blood isn't flowing to a part of the heart for a few minutes, so that part of the heart permanently gets injured, and cardiac arrest. So that happens when your heart rhythm or beat changes suddenly. So three things that coronary artery disease can cause is that chest pain and the angina, the heart attack, which is when you have a block in the artery. So here's a healthy, normal artery. Here is one that has a plaque, and it makes it harder for blood flow to go through. So that is a heart attack. What people sometimes get heart attack confused with is cardiac arrest. So cardiac arrest is my picture closest to the words on my screen there. Cardiac arrest is something that is electrical. So it's when your heart rhythm changes. So your heart is supposed to be bump, ba bump, ba bump. If for any reason and that happens through an electrical circuit that happens around our heart, if that rhythm happens to change where it starts to go bump, 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 or very, very slow, that can lead to cardiac arrest, which then gives you that flat line that you see on TV. So cardiac arrest is an arrhythmia. It is a heart rhythm problem, whereas in a heart attack, that is a circulation problem. That has to do with the arteries being blocked. There's something that's stopping blood flow to get to the heart. But both of those, as well as chest pain, can be caused by coronary artery disease. So symptoms of coronary artery disease. So a squeezing, suffocating, or burning feeling in your chest that tends to start in the center of your chest, but can move out towards your left arm, your back, your throat, your jaw. That is a sign of possible coronary artery disease. Shortness of breath while you're not doing much. So you're not really doing anything high intensity and you feel that you're short of breath. That can also be a sign. Out of ordinary tiredness or weakness. Out of ordinary tiredness or weakness. So for some reason you just keep on feeling like you're very weak. That can be a sign of coronary artery disease if it happens constantly. Having palpitations, so your heart fluttering, beating really, really fast, can also be a sign of coronary artery disease, and swelling in your legs. For women, listen up. So we also, as women, we sometimes experience these odd symptoms, which they fall really close in line with stress symptoms. And so you find that women often don't get diagnosed early enough for coronary artery disease because they sometimes have these symptoms. So listen to these symptoms. You'll notice a lot of them just sound like stress. So if you're feeling these symptoms, understand that it could possibly be coronary artery disease, because as females, we sometimes show symptoms different from what I said in terms of swelling, palpitations, shortness of breath. So sometimes as women, you may find that you could have coronary artery disease if you feel a vague chest discomfort, like you can't figure out why your chest is a bit heavy, if you're feeling tired, if you're having sleep difficulties, upset stomach, or anxiety. So it's crazy that some of those signs, anxiety, upset stomach, those are things that people often get when they're stressed. But it can also be a symptom for women having coronary artery disease, which makes it hard for a bit harder for it to be diagnosed for women. So keep that in mind. So let's go into non-modifiable risk factors. So these are risk factors that you cannot change. The heart and blood pressure go very much in line. So you're going to hear a few of the same things being said, but 2 times is good to help you remember. So non-modifiable risk factors, so things that you cannot change that in terms of affecting your risk of having coronary artery disease is 1, race. So if you are of African or South Asian heritage, you have an increased risk of having coronary artery disease. It seems to be linked to a change in culture, lifestyle, including food available, food choices made, and stress. So you can't control that, what your race is. You can't control your gender. Males are more likely to suffer from heart problems than females, but females' risk increase after menopause when hormone levels start to change and become similar to men. So when a female starts to reach menopausal age, you find that their hormone levels will start to be more in line with the values of men, and so then their risk for having coronary artery disease starts to increase. So we can't change that, whether you're male or female. We also can't change heredity. So if your parents have heart disease, your chances are increased of having heart disease. If your father had heart disease before he was 55, or if your mother happened to have heart disease before she was 65. So if they happen to have it after, it doesn't necessarily mean that that your risks have increased. But if your father happened to have any type of heart disease before he turned 55, you are now at a higher risk of having heart disease later on in your life. And if your mother happened to have heart disease before she was 65, so the values do change between the two. And if both parents happen to have heart disease, you happen to then have an even more increased risk of having heart disease, which doesn't mean it can't, that you can't prevent it. It just means that you then have to really focus on doing a lot of the preventative measures to make sure that you are not that you're as less likely to have heart disease or a heart episode as possible. Lastly, the other thing we cannot change is our age. So as we get older, our risk for having a heart attack and having coronary artery disease does increase because we naturally start to get that stiffness in those arteries because of that lack of elasticity that happens there. So yes, moving on to things that we can change. So some of these things we do have some control over where our levels stand. So first one is hypertension, so blood pressure. Uncontrolled high blood pressure causes your heart to work harder than it should, eventually weakening your heart and the arteries. So keeping your blood pressure in check is really important. You don't want to wear down the arteries, even if that means taking your medications as directed so that your blood pressure doesn't go overboard at any time. What else can you control? You can control exercise. So your heart is a muscle, and so exercising strengthens that heart muscle. Some other things, so what you eat, high blood pressure, being overweight, having high cholesterol and diabetes are all factors that we can have some control of, trying to keep them as close to being within the normal ranges as possible so that we don't have an increased risk of having heart disease and having a heart attack. Your risk of heart disease is also higher if you carry a lot of excess weight around your waist rather than your hips. So when you have a lot of excess weight and body fat around your waist, it makes it a lot harder for the heart to do its job because of all that extra adipose tissue that is right below it. So it is more healthy for you if you find that you have a lot of weight that you carry in your stomach area, to try and reduce that as much as possible so that your heart isn't working in overload all the time and just getting strained out. So treatments. So if you happen to have coronary artery disease, treatments vary from prescribed medication, like up here, to surgeries such as coronary bypass surgery or non-surgical procedures like having a stent put in, so a PCI. And sometimes, depending on your doctor, they may tell you to take an aspirin. What an aspirin does is it helps to dilate the arteries. So if you happen to have any blockage that's happening in the arteries and you take aspirin, sometimes people say that if they feel like they're having a heart episode, a lot of doctors will say, okay, if you feel like that's coming on, if you feel something odd, a chest pain or something that you can't figure out, to take an aspirin. What that does is it helps to dilate the arteries. So the arteries that may have been blocked by some type of plaque, it could have been blocked by a blood clot, which that's the thing about having a heart attack. Some people happen to have that plaque that's built up in the arteries. And when that fully gets blocked is when someone has a heart attack. But some people can just randomly be the healthiest people in the world, but they just happen to have a blood clot from their body trying to heal from something. And that blood clot gets stuck in the artery that's up at the top there. If that happens again, what you're having is there's no way for blood to continue going through that artery, which is why some doctors will say that if you happen to feel any chest tightness or something that feels very unusual, to take an aspirin, because an aspirin helps to dilate temporarily dilate that artery and make it a little bigger so that you can get a bit of blood flow through that artery. And so the top image I have there, that is a stent procedure. So a stent procedure is actually not really considered a surgical procedure because it can be done while someone is awake. It's done by bringing a stent into the artery. And so if there was a lot of fatty plaque and buildup in the artery, the stent goes in and then it blows up like a balloon to try and push all of that fattiness towards the sides of the arteries so that blood can now go through. And then they pull that balloon out and you now have it where your artery is a bit more clear. The picture at the bottom there, that is an example of having a coronary bypass surgery. So you have it where you now have all those little white lines that you see around the heart are veins that have now been put into the heart to try and allow blood flow to get around to places that were blocked. So in that image there, you see some black speckles. Those are areas of the heart where it's been blocked by some type of plaque. So the bottom of the heart is no longer able to get blood flow. So the bottom of the heart will start to die if it loses blood flow for a prolonged period of time, a few minutes or longer. And so you then have it where veins are then put in from where blood flow happens normally to try and connect over and pass over some of those areas that are blocked so that the heart is now getting that blood flow again. And so that is your bypass surgery. So you can lower your risk of heart disease or having further damage by knowing and controlling your blood pressure, your diabetes and cholesterol, and taking your meds as prescribed. It's also important to lead a healthy lifestyle. So doing these few adjustments can also help you reduce your risk of having coronary artery disease and having a heart attack. So being smoke-free, being as active as you can be, having a healthy, balanced diet, watching your weight, trying to make sure you have a healthy weight going on, drinking less alcohol, and managing your stress. So yeah, so try and do as many of these as possible, really taking care of your health, even if you do happen to have a high risk of heart disease, knowing that is very important so that you can then try to do all of the preventative measures to reduce your chance of having a heart episode. There's some people that happen to have both parents that had a heart attack before they were 40. And so their chances are very, very high for having a heart attack themselves, just because of the construction of how that parent's arteries may be around the heart. So depending on how your heart is structured, our hearts all act completely different. So we have it where our arteries run different ways for each one of us. If your parents both happen to have heart attacks very young, it makes it where you unfortunately do also have it where your chance of having a heart attack or heart disease is increased, but that doesn't mean that you have to have a heart attack in the future. Following a healthy diet and following some of these healthy lifestyle tips, a lot of people can go through their lives where they look at generation after generations of people having heart attacks, but themselves don't have it, as they've been trying to do all of the necessary steps to stay healthy and to keep those arteries clear and clean so that blood flow can happen through them normally. And remember, blood pressure and heart disease both revolve around those arteries. So that's why we're trying to keep them as clean as possible, try to keep your cholesterol levels down, try to exercise to keep those arteries